Welcome back. This morning, the FDA is preparing some new guidance on Tylenol use during pregnancy after President Trump and White House health officials linked it to autism. Our Julissa Garza has been following all the developments this morning and really helping us understand what all of this could mean. Julissa?
Yeah, Alona, most doctors and researchers say Tylenol is considered to really be the only thing safe for pregnant women to take. Other common pain relievers like ibuprofen and aspirin are already discouraged in pregnancy due to the increased risk of miscarriage and birth defects. But after yesterday's announcement, questions are now looming about the use of Tylenol. So to help us understand more, Dr. Todd Ivey, an OBGYN associate professor at Baylor College of Medicine, is joining us this morning. Doctor, thank you for being here. First question, what does the science say about Tylenol and its link to autism risk?
Well, good morning, and thank you very much for allowing us to address this important topic. The science is quite clear, the good science that is, and it shows that there's absolutely no causation to taking acetaminophen to autism in pregnancy.
Now, would you say that Tylenol is still safe for pregnant women to take right now, no matter how far along they are in their pregnancy?
I would. I think it's important to remember that pregnant women should only take the medications that they absolutely need in the dosages that are recommended. So a good discussion with your healthcare provider is warranted here. But Tylenol or acetaminophen is the active ingredient, and that is the only safe pain reliever that we have. We know that women take this for a variety of reasons, whether it's pain, fever, infection, persistent headaches. There are numerous uses for this medication during pregnancy.
And for pregnant women who listen to this new advice after yesterday's announcement and choose to not take acetaminophen for a high fever, what's the risk there for them?
Well, fever has been linked to autism as well. I think there are many potential complications of having things that need treatment go untreated in pregnancy. And I think it's important to remember that a lot of the concern are based on associations, and associations do not prove causation. I was speaking with a colleague of mine who we started discussing polio back in the 1940s when they saw polio rates, diagnosis rates of go up in summer months, as well as ice cream sales. And for a while there, people believed that polio was linked to ice cream. We know that's absolutely not true, but that shows the problems with an association versus causation.
Now, what's your advice for pregnant women or new parents who may feel very confused right now? You know, in these past 2 weeks, we've had major announcements when it comes to women's health care, children's health care, especially with vaccines.
Well, we know that vaccines do not cause autism as well. Acetaminophen does not cause autism. But before you take any medication during your pregnancy, you should consult your healthcare provider. And remember, take it only in the recommended doses if approved.
Now, doctor, I want to talk about, there have been different studies released, especially last year, that followed some children for about 25 years. Do we expect for doctors to continue relying on those studies as these questions continue to loom for people?
We do. The best study was actually published in the Journal of the American Medical Association last year in 2024, and it was the best scientific quality study to date, where it looked at millions of children. And it actually, unlike other studies that people have based their association beliefs on, this study actually matched siblings, meaning they looked at some siblings that were exposed to Tylenol in utero and other siblings that weren't. And there were absolutely no differences found. So this is our most robust study and the one that we really should put most of our faith in.
Doctor, thank you so much for joining us and helping provide such wonderful insight for our viewers at home. Alona will go ahead and send it back to you in the studio.
Yeah, really.